Health Education Lecture Series. All the listeners of Health Education Lecture Series, I'm your host Gurdeep Singh Sandhu, homeopathic consultant. My clinic address is 7021 Village Parkway, Dublin, California 94568, and phone number is 408 687 1899. A few minutes late. I'm sorry for that. Because of some technical problem, I could not start my program at 5. Sorry, yeah, at exact 5. But now it's 5:07, 7 minutes late because of the technical problems. Okay, so let's come to the point. As you know, in these programs, we are discussing about the how the life is created from life, and step by step the progress of life after being fertilized in the fallopian tubes, how the ovum goes forward to create a new life. And the mother's womb, this life has spent about 280 days. And within these 280 days there were many more developments in his body, and it has been completed into complete fetus. And complete fetus, having all the body features and all the systems inside the bodies. And within this period all the body systems started working normally. Means, if ever this body will come out of the mother, then uh, it can survive even without the mother as well. So all these things we have already discussed with you, and so that you can understand how the life was created, developed, and reached up to this level that we are surviving. So in this way, sorry. Okay, so in this way, step by step, we are discussing all about the life, and we are at the stage of labor. And in this labor, we have discussed this labor by dividing it into three stages: first stage, second stage, third stage. And what happened in the first stage, what happened in the second stage, and what were the complications in the first stage, and how we have to get rid of that one. What were the complications of the second stage, which was very serious type of complications, which we have to tackle with that if ever they come up, and how we can manage the labor at that times. That has been discussed in my previous programs. And today is our program, the third stage. The third stage, as you know, after the delivery of the baby, after the delivery of the baby, means baby has come out of the mother's womb, and then we have to manage this thing. All these things were discussed previously in other radio stations and lectures. And today we will discuss this thing, that under these conditions, the serious condition is the hemorrhage. First of all, in this third stage, we have to take care of the umbilical cord, we have to take care of the placenta, and we have to take care of the expulsion of the membranes in a whole, so that there should not be any trace of the internal membranes. There should not be any particles remaining inside the mother's womb of the placenta, so that it should not continue oozing blood from mother's womb. So all these things we have to make sure. And also, we have discussed about the cleaning of the eyes of the fetus when the head comes out, so that any motherly infections from the UTI, infections from the vaginal type of things, may not affect the fetus eye, so that it may not cause any problems in the visions of the fetus. In this way, after that, we have to take care, In case there is a large head coming out and the passages are not sufficient to let it pass, then sometimes we need artificial means to deliver the baby, that is forceps delivery, or sometimes the suction delivery, or even after that, sometimes if the vaginal area is not accommodating the whole head and not getting it coming out, under those conditions we have to do the episiotomy, a small section in the labia majora, the lips of the vaginal area of the female, so that it can enlarge the vaginal area so that a head can pass easily from that one. So this is what we have already discussed. After the delivery of the child, then we have to take care of these wounds, which these are surgicals or sometimes, but we have to take care of the perineums. We have already discussed that the perineum is the main important organs, main important, the area should not be ruptured during the passing of the head of the fetus. If it ruptures direct in the lower end of the vaginal areas, then there is a damages to the nerves which are supplying or controlling the nervous system functionally, and also the sensationally, means sensation and functions may be lost if in case this perineum is ruptured. So we have to take care of the perineum when delivering the head of the baby. So that yesterday we have already discussed about this thing, that you have to support the head from downward to upward, so that it should not put pressure on the junction angle of the lower angle of the vagina. And if we will not do that, then there are chances that the perineum will be ruptured, and that may cause severe pain, and after that, that may cause the powerlessness in the uterus. And if that occurs, the powerlessness, under those conditions, because the powerhouse has been damaged and those nerves have been damaged, under those conditions there is possible that the contraction of the uterus may be lost, because if there is no contraction after the passage of the baby out there, then there will be a regular bleeding and you cannot control it. Because after the baby is delivered, there and this placenta is separated, then there is a raw ulcer, you can say, the raw wound inside that, which oozes blood, gushes in large quantity, and that is only controlled by the contraction of the uterine muscles. And if the powerhouse has been damaged, means the power is lost. Ultimately, the uterus may not contract forcibly to contract the blood vessels which are oozing blood over there. So that may cause a serious condition at that time. Sometimes we have to interfere surgically to contract all those things. So this is what was the management in third stage, that you have to protect the perineum, the lower end of the vaginal area, by supporting the head upward by your hands. And also, the second thing, you have to take care of the wound caused by partial separation of the placenta, because sometimes placenta has to come out after the baby has come out. The time period for that, I have told you, about 5 minutes to 30 minutes. And within 5 minutes to 30 minutes, if there is no rupture of the perineum, all the nerves are working normally, all the nerves are contracting the uterus normally, and also the effects of the oxytocin hormone, which is being released from the anterior pituitary, is working normally. Then the muscles of the uterus will contract normally and there will be stoppage of bleeding. But if all these things, means the oxytocin hormone is not produced by somehow or others, due to stress of the female being unconscious or something like that, or if the nervous system, controlling system of the uterine contraction is failed, that is when the perineum is ruptured, then there will be regular and continued bleeding from the vagina, from the uterus, and that is very difficult to control that. Then you have to control that, because the second thing after taking care of the baby, the second thing is to take care of the mother as well. And to take care of the mother, blood pressure should not fall at that condition with the heavy bleeding, and pulse rate and all that you have to check. Cyanosis of the females at that time, the oxygen level and also the hemoglobin level, and all these things should be checked around. After that, the major important thing is that you have to watch the placenta to come completely out. Come completely out means the placenta has its diameter of 20 centimeter, and the weight about 1 to 1.5 pound, depends upon the weight of the baby and weight of the developing stages of the female at that time. So sometimes it may be 1.5 pound, but now normally it is 1 pound, which is normally considered, because the weight of the female during pregnancy increases about 28 pounds, out of which 8 pound is considered the weight of the baby, from 7 to 8. Sometimes there should be variations, because all the babies are not measuring the same. So 7 to 8 pound is normally considered the weight of the baby, and about 2 pounds are considered the weight of the umbilical cord and the placenta, and also some weight of the membranes which are inside. That membranes, I have already told you, that the inner lining of the uterus, which in a normal course, when there is no pregnancy, that inner layer of the uterus is formed every month and is released out with the menstrual flow. That's known as endometrium. But there is a pregnancy, when there is a pregnancy, in that condition, this endometrial linings of the uterus has been given a different name and divided into three phases, or you can say the three names are given according to its function, and then it's known as decidua. The name is changed as decidua to the internal membrane of the uterus during pregnancy. And then after that, the portion of the decidua where this fertilized ovum coming from the fallopian tube has been attached, that is known as decidua basalis. And after that, it squeezes and contracts and take care of the baby which is attached over there, that is known as decidua capsularis. Just like the this decidua is working to support the baby so it should not fall, because it has to get its insertion into the uterus, and when it has to get insertion into the uterus, at that time it may fall down. And to protect that conditions, nature has provided a type of capsules of the decidua. Means decidua from the sides is contracting and taking it or holding the this fetus so that it should not fall. That then this portion of the decidua is known as decidua capsularis. And how the nature has made all arrangements. And the remaining portion in the whole uterus, the remaining portion of the decidua is known as decidua vera. And all about this thing, what's the function of the decidua basalis, what's the function of the decidua capsularis, what's the function of decidua vera, we have already described all these things in the previous lectures. But our lecture today is the management of third stage. So in the third stage, number one, management of the fetus, I. Management of the strangulated cord, management of the short cord, management of the partial detachment of the placenta, management of the complete separation of the placenta during delivery, during the third stage, because after that it has to come up. And also the major important thing which sometimes affects that is to control the placenta previa conditions. And about placenta previa conditions, I have given you the knowledge about in my previous lectures, that mostly when the fertilized ovum comes from the fallopian tubes and is inserted into the uterus, the normal position of this is to be inserted in the uterus is on the back portion, upper and back portion, upper segment of the uterus and back portion of the uterus. But sometimes it may be attached to the right side or the left side of the uterus. But because of some problems in the uterine shuffle, that uterine shuffle is a normal movement of the uterus which starts after a girl becomes adult. After a girl attains the puberty, means the hormonal program starts in the female cycles, estrogen hormone, LH hormone, follicular stimulating hormone, all these hormones sequentially starts erupting, developing inside the mother's inside the girl's blood system. Then under those conditions, uterus starts moving regularly, just like our heart is moving and we do not feel it. Heart moves 70 to 80 times per minute, but we do not feel it. And respiration, we are taking the respiration 14 to 16 per minute, but we do not feel it. Normally it's going on the same way. When a girl attains puberty, means the hormonal cycle starts, then there is a normal movement in the uterus continuously, like the heart, is known as uterine shuffle. And because of the normal movement, this fertilized ovum is inserted into the upper segment of the uterus, just in front, because the fallopian tubes are attached to the uterus at the upper segment. But because when it dips down into the uterus, then because of the excessive movements of the uterus, uterine shuffle, it falls down. Then it falls down. In this condition, someone is directing me here that my photo is perhaps not coming normal. So what I can do, I can just change in this way, rotate. Okay. Okay, we'll see it later. So that those uterine shuffles, if they are more than normal, then under those conditions, these are normally these are synchronous with the heartbeats. But if they are increased in numbers because of the hormones, then this fertilized ovum can fall in the lower segment of the uterus, and then sometimes it covers the outer orifice of the uterus at the cervix, because uterus has three portions. The upper portion is the known as the fundus, the lower portion is known as the body, the lowest portion is known as the cervix. And at the junction of the body and the cervix, it falls down. Then it falls down and is inserted over there and then start growing over there. The fetus, in spite of hanging down from upward to downward into the amniotic fluids, it swings upward. It swings upward and its insertion is downward. It's okay, no problem. The pregnancy will continue. It has to take food and materials from the mother. It will continue. But at the time of delivery, especially at the time of second stage of the labor, this placenta previa will cause problems, will cause complications, and we have to take care of that one. So this is what we have to take care at this stage, that if the partial placenta previa is coming with the fetal head, then you have to palpate it. Then you have to diagnose it. And if the placenta previa is coming up, sometimes it may cause problems because the orifice, the opening of the cervix becomes small. And sometimes it may cause a difficult delivery, and we need to get it forceps delivery or sometimes the suction delivery to facilitate the passages of the head from the uterine womb. But sometimes you have to push the placenta portion of the placenta previa backward so that it can give space to the head to pass outside. So these are technical things then we do at the time of the labor, which depends upon the condition to conditions. And sometimes with this placenta previa, sometimes when it is pressed upon with the mother's wub, bony structures, and the head, and sometimes it may be pinched, ruptured. And when it is ruptured, it brings a heavy bleeding over there. And that heavy bleeding sometimes, if the fetus, that's known as baby Nicole, if the fetus is in the amniotic sac, that is the water bag which is coming before the baby, that is known as forewater bag. But previously, when it was in the uterus, it is known as amniotic sac, and in which there is a fluid, that is amniotic fluid, in which the baby was moving all around throughout the pregnancy. But at this time, during the pains, baby goes forward, baby goes backward. In this way, the whole water approximately comes in front of the baby. And now we are talking about the placenta previa, that it is coming with the head. When there is the extreme of pain, head is pushed downward, and along with that one, there is a part of the placenta previa which is at the orifice. It's also pressed downward. And when it is pressed down, under those conditions, you have to take care not to rupture, not to rupture the forewater bag until the head is fully delivered. If the forewater bag is ruptured before that, then in that condition, that blood which is oozing from the placenta previa may go inside and may come into the mouth or the nose of the baby, and in that way it can cause problem in the respirations. So, at this condition, you have to take care of the placenta previa so that the it should not cause any problem in the rupturing of the forewater bag. And you have to protect the forewater bag not to be ruptured until the head is delivered, so that you can safeguard the mouth and nose and eyes, all that one. So this is the condition. And the second thing is, when the placenta previa is a complete, that complete placenta previa is that the placenta, all, what is that called, all placenta is just covering the whole outside opening of the uterus in the cervix. And then under that conditions, before the head will show up means whatever the part is coming up out, whatever the part is coming up out, that's known as show up. What's the show up? Show up is head, show up is shoulder, show up is the occipital part, whatever it is, that's known as the show. The show will not recognize the head is coming out. Show is not recognize any part of the fetus is coming out, but you will see a pulpatory mass is coming out. Astonishing. The total placenta previa. And also, with the extreme of the pain, when the placenta previa will be totally detached from the mother's womb inside, then there is a big bleeding at that time before the baby is delivered. And again, make sure the forewater bag, it is still in the backside. And normally, when the placenta previa is complete, forewater bag is not coming out, and there are not chances of rupturing of the forewater bag because placenta previa is in front. So placenta previa, if it's a partial, there are chances that it may rupture and it may cause some problems. The blood may go into the mouth of the fetus and nose of the fetus, can cause respiratory problems. But if the placenta previa is a complete, it means before the baby comes out, this placenta will come out, and you have to take care of that conditions at that time, so that this forewater bag is in the backside. And after that, when the placental bag is coming out, there is a big bleeding, but in between that bleeding, you have to deliver the baby. In between that bleeding, you, because bleeding is already coming, even if the placenta has come out, even then there is a raw surface inside the uterus from where this placenta has been detached. And from the placenta has been detached, it means there is a raw surface. It's oozing bleeding continuously. It's oozing bleeding continuously. And then again, you have to take care at this stage that the 4 water bag should not be ruptured. 4 water bag, because which is coming after the placenta. Now the placenta has already come up, and then you have to deliver the baby later on, and it should be with a complete amniotic sac, so that any bleeding, any external secretion from the mother's womb should not go inside to harm the babies. So these are some other technical points we have to deal with when we are at the third stage of the labor. So bleeding is a serious condition. At this condition, bleeding is a normal condition. Some of the pregnancies, sometimes there is a twin pregnancy, sometimes there is a single pregnancy, but in most of the twin pregnancies, there is a heavy bleeding more than normal. Under those conditions, you should be careful to take care of the mother as well. Because when we started the precautions in the pregnancies, I told you there are 5 different points, and 5 different points were: the first of all, take care of the passenger. Who is the passenger? Passenger is the fetus. He is coming out. First of all, you have to take care of the passenger, whether the passenger is healthy, normal, or there is any problem. So, problem of the fetus were detected by the fetal heart sound. If the fetal heart sound, which is the 140 per minute, is the normal fetal heart sound, if it increases more than 160, it is something wrong with the baby, something complicated in the babies. And those complications, I have told you, it may be strangulated with the cord. If the cord is long, maybe surrounded around the neck of the babies, and that may cause strangulations and breathlessness of the baby and distress of the baby. So you have to check the fetal heart sound time to time to check it whether the baby is in distress or not. So at that time, you have to take care of the cord. Sometimes you have to cut the cord before the baby is delivered, because if it will be in the forceful pains, strangulations of the neck, and it is more than 3 to 5 minutes, sometimes baby can die. So for that one, I have yesterday told you about this one, that you have to cut the cord even before the baby is delivered, so that you have to clamp the cord from both sides by palpating with your fingers, and then to cut in between, and take septic measures, so that infection should not go to the mother and infection should not go to the fetus as well. So these are the conditions if it is surrounded around the neck. The second thing I have told you in that conditions for taking care of the passenger is that if the cord is small, then also there are chances of the detachment of the placenta partially or completely, and partially or completely, even the baby is coming first. Even then, that can cause a heavy bleeding. But still, if the baby is in the water bag, even then it's safe. But if the water bag is ruptured, that causes another complications. So we have to take care at this stage. We have to take care of the passenger first, and second, we have to take care of the uh, uh, pathway. Pathway is mother's vaginal area. We have to check the pelvimetry. We have to check the dilatation of the cervix. That we have already told you about. The normal dilatation of the cervix is 10 centimeter. And if it's 10 centimeter, and we can assume that the normal head of the baby will pass through that normally, because it is assumed that the normal baby is head of the normal baby is not measuring more than 10 centimeters. But if there be any complications like hydrocephalus and other complications which may arise inside during the pregnancy, that may cause another problems. But passages normally 10 centimeter, and the pelvimeter. Pelvimetry means distance from bone to bone, distance of the pelvic bone to bone, pubic to pubic, ischium to ischium, so that it can accommodate the whole length of the baby in that for the delivery. So that should be taken care of before in the previous interviews or the previous inspection. That is known as antenatal care. At that time, antenatal care, we must check the pelvimetry of the female, that it should allow a normal passages for the delivery of the fetus. So in this way, second point is to take care of the passages. The third thing is to take care of the mother, fetus, passages, mother. Third thing is the passages, the mother. In mother, we have to take care. There should not be any heavy bleeding. Or if you advised this episiotomy, then you have to take care of that wound. If the placenta previa or partial placenta previa was there, you have to take care of the wound to save it from the heavy bleeding, or to save the mother especially from the heavy bleeding, that there should not be any other complication with loss of excess blood. So, and after that, the socially, sometimes in our society, what happens if there's a baby girl born, sometimes mentally the females are distressed, even the family members are distressed. At that condition, it has been mentioned that we have to take care psychologically. Psychologically, we have to make built up mentally the mother and also the family as well, so that they can protect, they can save, they can safeguard, and also support the mother at that times. And the last thing, in this way, to protect the membranes outside or surrounding the web. Surrounding the web means if you have a cut on the episiotomy, or if there be any rupture of the premium lower downside portions, that you have to take care of that. So these are 5 points I have discussed with you, that mainly should be taken care of depending upon their complication. What complication can cause what type of problems, what type of complication can cause what type of another problems. And then if they are, any of them is causing any problems, then how you have to take care of that. So we have discussed in this lecture today, if this cord is small and there is a partial detachment of the placenta, how you have to take care of that. If there is a cord surrounded around the neck, and then there is a fetal distress, then how you have to take care of that. If there is a placenta previa or partial placenta previa, then how you have to take care of that. If the head is large, then how you have to take care of the opening of the mothers by doing the episiotomy. And if there is a pelvimetry is contracted somehow previously, then under those conditions, you have to protect the perineum, means the low portion of the vagina, which is having the nervous system, the junction box nervous system. So that you have to protect that one. Today, our time is over, and next day we will discuss how to manage the bleeding, especially because in this we have to taken care of the air passages, we have taken care to the eyes, we have taken care the fetal heart, but fetal heart sound again I will discuss yesterday again, because fetal heart sound is not the normal heart sound as we have in our body, because it is different. And why it is different, that I will discuss tomorrow. That the fetal heart sound, we should not be astonished about that one, because it is different from us at that times. And why it is different from us, it's not abnormal, it's a normal thing, natural things, but it has to recover and come to the normal level as normal human being is having, but at that time it's not normal. So that things I will discuss tomorrow in this lecture, so that you should be aware of all the complications, and you should be knowledgeable to control all the complications and manage all those things. So main thing yesterday, we have already discussed all these points in Punjabi and Hindi sections. Today we have again repeated all those things. And tomorrow we will, because bleeding is the serious conditions in third stage of labor that you have to manage. And then after that is the management or watching of the ovulation, that is known as ovulation of the uterus and of the mother as well, because uh, changes in the abdomen, changes in the uterus, changes in the fallopian tubes, changes in the mother swab, changes in the vagina, all these things happens, and I will let you know what happens side time to time, what happens time to time, that you have to watch that whether the lady after delivery is developing normally, coming to the normal position, or is there any complications. And that's a more important thing, that after the delivery, a lady or a mother should have her normal life. And what are the changes which remains, which are not converted, which do not go back normal to their previous conditions, but even somehow they come close to that. So that everything I will discuss. What are the changes in the abdomen and how you can cope up with that? What are the changes in the uterus? How these take place? What are the changes in the vaginal area? And how you can maintain that? What is lochia? And sometimes doctor says it's a fourth stage of labor. Basically, delivery, baby has been delivered in the second stage. In the third stage, the membrane and the placenta has been delivered, and there is a complication, excess complication of the bleedings, that we have discussed, when we will discuss again that what are the special measurements you can take to avoid this bleeding. And after that, the period is known as purperium periods, that goes up to 40 days. But the normal period of the purperium, medically termed as 6 weeks. And what happens in these 6 weeks, I will describe you yesterday, that one by one, what happens after 2 days, what happens after 1 week, what happens after second weeks. So all these things, it goes up to 6 weeks. And then within that period, when this milk starts in the mother's breast, when and how, what are the structures inside the breast, how the breasts are developing into milk pumping organs, and what are the hormones which are taking place to develop it into a milking organs. So all these things systematically, one by one, I will discuss with you in our coming lectures. I will request you to please continue listening all these programs, and also advise to your friends, family members, so that they can listen all these lectures and be aware of all these conditions. If there be any complications, and should not be nervous in these conditions, take appropriate measures to protect the mother and the fetus. Rabraka, God bless you all. And now, tomorrow, I will deliver Punjabi and Hindi lectures, and will manage the third stage bleeding.